One of the feared complications is when the pregnancy is outside the uterus. For the woman, she may not even know God has answered my prayer. She's happy. And the only sign she may get is depending on the level of severity. The ectopic may be unruptured, it may be ruptured. If it is unruptured, don't say, I'm having pain. That will not prompt the doctor to say, okay, let us confirm the location of this scan and see that this pregnancy is not in the uterus. This pregnancy is outside the uterus. Now, again, she may tell you, doctor, I am spotting. Bleeding is likened to the normal menses every woman has monthly. But in spotting, it's just like a drop of blood. You will see it, this is blood. But after some time, nothing again, the pant is clear. So she will tell you, I am seeing dark blood in my pants. So you want to do other investigations that will now tell you this pregnancy is not in the uterus. Now, if it is a ruptured ectopic, this is more dramatic. There will be severe bleeding. And the bleeding can result in shock in the woman. The woman can suddenly just collapse. And if help doesn't get to her on time, she dies. You see, it can be so severe. And meanwhile, for this type of patient that has collapsed, there is no external bleeding. You will check her pants, no bleeding. But you will touch the abdomen is tense, there's severe pain. That is why I always advise, as possible in this pregnancy, do an, if not for anything, to confirm pregnancy and to confirm the viability of the pregnancy. So an early scan in the course of a pregnancy is an invaluable tool for both the woman and the managing obstetrician. So that is for first trimester.
What are those signs in the second trimester? Now this is not the early part of pregnancy. We have gone past the first 13 weeks. What are those signs that we need to see and we know that quickly see your doctor?
I said the second trimester, funny enough, is a relaxation phase in pregnancy. Oftentimes, the second trimester is peaceful. By this time, the woman has adjusted well to the changes that occurs in pregnancy. However, it is not without its own complications that are peculiar to it. It is during this time that you can actually detect those who will develop hypertension in pregnancy. Again, it is during this time that you will detect those who will develop diabetes in pregnancy. Again, it is during this time that you can pick women who will have anemia, women who will have urinary tract infection and malaria. So what are the signs that will tell you that this is this and this is that? For hypertension, most women with hypertension are actually asymptomatic. They don't have any complaint. They are normal people going about their normal duties. No complaint. But on very rare occasion, they may just have this slight headache. They tell you this headache, it comes and goes. It is discomforting. I really don't understand. But doctor, anyway, I just feel uncomfortable. And by the time they come to the hospital, you check their blood pressure, it is elevated. You check their urine, there is protein, or there is no protein. So you will know that yes, this woman has already developed a complication which we call pregnancy-induced hypertension or preeclampsia. Now, it's just enough for her to start panicking. Oh my God, oh my God. No. Such conditions can be managed. They can either be mild or severe. So if they are mild, they can be managed. The woman will go home, come back, be coming from home for her normal clinic, and nothing happens to her. But she shows supervision. Now, for the woman that will develop diabetes, She may again not have any complaint, but if she wants to have complaint, there are some things the doctor will see in her during the antenatal that will arouse his suspicion. This can include her weight gain. Now, when a woman second trimester has already gained kg, is that not a reason for you to be suspicious? Why would she gain so much weight in such a short time? It means something is wrong somewhere. When you now examine the abdomen, you will discover that compared to her date, the baby is too big. Again, you discover that this woman has multiple boils all over her body. She tells the doctor, I don't even understand. Today there is the other armpit. I just checked my pants. I saw boy in my private. Now they begin to suspect their husband that he has gone to bring disease for them, not knowing that it is just sugar that is causing this problem. Another symptom they have is recurrent vaginal discharge. Doctor, itching. I'm having discharge. It is smelling. Normally in pregnancy you have discharge, which is worse during the first trimester. It's whitish and does not smell. By the time you now have discharge that is yellowish, brownish, or greenish, and there is acid, which is malodorous, and there is itching, it means there's infection. So you need to seek urgent medical attention. Abdominal pain is common in the second trimester. And funny enough, the causes may not be from pregnancy. Remember, it is not only the baby that has the license to stay in the abdomen. There are other organs that the baby met there before. So those organs may be undergoing some disease. An example is the appendix. Acute appendicitis can occur during pregnancy, and it is worse off in the second trimester. The only complaint she may just have is abdominal pain, or there may be vomiting.
Thank you.
There may be diarrhea. It's not taken. The appendix can rupture if it is severely inflamed and may result in death in this woman. Again, some women have ovarian cysts that coexist with pregnancy. This cyst begins to grow as the pregnancy is growing, and it gets to a stage, it is now big. This cyst can twist. When it twists, we call it torsion, and it can result in severe pain and can cause shock. So such a woman will need surgery. Again, you have many women that get pregnant with uterine fibroid. We have seen cases of fibroid coexisting with pregnancy. In some women, it will not give them any complaint. This fibroid will outgrow their blood supply and start to undergo changes. The commonest is what we call red degeneration that occurs and is associated with severe pain. The women come down with terrible pain. We need admission. These things are common in second trimester. Urinary tract infection. Symptoms will come as headache, body pains, joint pains, vomiting. All these are the patient will complain of, and by the time you know this is a danger sign, and you will need to take urgent care of that woman. The meat of the matter is in the third trimester.